Hey guys, I'm Robert Gardner and I'm happy to bring you this Upper Back and Neck Secrets CE class for 2 free CEs. We're going to go over an easy to use upper back and neck sequence you can use on a table right where you are. Doesn't cost anything. If you want to help me, you can take this and share this link with your friends and massage therapist colleagues across massage therapy groups. Probably I'll have this on YouTube and Facebook, but this is designed for you to get a good sampling of my work, my teaching style, and how I'm putting information together. These interactive live stream classes are an ongoing part of my business now, where students are taking class live as part of our CE party. People are joining in completely free unless they want CE credit. If you want CE credit, you got to pay, or you can take these free version of the classes. People are actually tuning in live as part of the CE party. They are texting or calling me to ask questions live that I am answering inside the live stream. This is really revolutionary stuff for education. I'm putting anatomy on screen. You'll see it just after this. But thank you guys so much for tuning in. Again, if you want to help me out, just go ahead and share this with your colleagues or massage therapists. In addition, you can go ahead and join us for our live streams each month. The best way to get started is to join our CE subscription service, the Reboot Insiders Club, is to go ahead and join that. There's a vault with over 600 hours of my curriculum and instruction. If you're watching this on YouTube, that link is right down below. So you guys enjoy learning how to work on upper back and neck pain, and I'll see you guys again very, very soon. If you have any questions for me, feel free to reach out. Be happy to chat with you. So we're going to give and receive today for an hour. So one of you is going to give, there's going to receive, and then we're going to switch. I'm going to go through this meticulously and slowly, and I'm going to cover some of the basic anatomy before we get on the table, just so you can kind of seal this in your craw as like what we're going over. One, we're going to be doing stuff related to the pectoralis major and minor, trying to open up the chest. And I'm going to talk about this in detail because I think if you understand this intellectually, it's going to make what we're doing make more sense. We're generally going to be working on, stuff in the upper back and neck, trapezius, levator. Scapula is one. I think scapulae is two. Correct me on that if I'm wrong. Then when it comes to muscles in the back, lots of complexity, but I don't want you to feel like you have to memorize any of this. Even I, as an educator, go back and check this stuff out on Google. I pull up my anatomy coloring book, go over origin and insertions again, because there's just so many muscles that we wind up having that cause all of the micro movements and undulation that happen in our spine. Two of the muscles I'm going to talk about in the neck, but certainly not limited to, semispinalis capitis and the suboccipitals. I'm also a big fan of splenius capitis. I see a lot of issues with that in my practice and people with upper back and neck pain. And one of the things intellectually I want you to understand is this. Part of the reason people have a lot of back pain, in my opinion, is because we're bipeds. We made evolutionary trade-offs to stand upright, and everything we do is pulling us into thoracic flexion, which is that rounded forward shoulders we see all the time. When you look at the dog being on all fours, everything in the posterior chain is lifting them up and creating a situation where the muscles in the posterior chain are stronger so the dog can lift its head and look out and around. The problem with us is we spend so much time driving and at computers that we wind up in the exact opposite position of the young lady in the backbend. We wind up in thoracic flexion instead of thoracic extension. And what we're going to be doing when we start off in the beginning here is trying to help bring that person into thoracic extension. You need to understand that, but I do want to make clear, when you're working with clients, that's not what they want to hear. They don't give a rat's ass about thoracic extension or thoracic flexion. They want you to help them with back pain and help them with back pain immediately. So I want you to pick one of you, whoever's going to receive first. What I've done with my table, or I should say Andrea's table, is I put it at the lowest setting I could get it to. This is going to work for this. If I was mixing effleurage and like Swedish would tie, I might not do this because my body mechanics would be off if I was leaning over, trying to, deliver pressure, okay? When I do this, it's because I know that this entire session is going to be more like tie style upper back and neck work. The way that this works for me when I talk to the client, let's say I worked at a chiropractor's office, which I'm very familiar with because that's what I used to do. I would go ahead and do the following. The client would come in, they'd come in for their massage. I'd say, listen, Andrea, what are you having problems with? Oh, her upper back and neck. I feel like Bill Murray in Groundhog Day. And what I would do is say, listen, are you having problems? Is it always like right up here?
Yeah.
Okay. Now, I did that just to establish some touch contact so that the client knows I know where the spot is and he's going to work on my spot, and like she feels a sense of ease already. I would tell the client, take off your shoes and lay down on the table just like you are. I'd put a bolster or a pillow and put them on their side. Now, automatically, this put them in a slightly different space. Most of the clients had never done any clothed work, and they'd never done any work in side lying, unless they were pregnant. So it automatically was like, if I saw him questioning what I was doing, I was like, listen, I've had 12 years in chronic pain management. Give me 5 minutes, trust me, if they were all skeptical. What I'm going to wind up doing is creating a little bit of space in the trapezius and in the levator scapula using this positioning. The first thing I want to do, though, is I want to get a bolster, or in my case, I'm going to use a blanket because I think this is going to work better. I'm going to take this blanket and I'm going to roll it up and create a bolster for her hips. We're only going to have 30 minutes on each side, okay? So this is going to go by super, super fast. I hope that the person you were about to work on is on the table comfortably. I'm going to do this. I'm going to lift your head for me. I'm going to scoot this up just a little bit. Can you scoot up for me? Just a hair. And then this, do you feel like you're supported? Not going to fall off the table? So the first thing I want to do is, we came in before and touched this spot. Because she's like, yeah, my upper back and neck, it's always right in there. Primarily, what I'm going to do is I want to affect the levator scapula. I want to affect the upper trapezius, you see there on the right, because I want to pull that down and open. What it's also going to do is it's going to start to pull into these neck muscles, and it's going to simultaneously open the chest. These two, especially pec minor, real booger. Pec minor, I think, is inordinately problematic for that positioning we talked about, which is thoracic flexion. I'm going to open that up and do it in a drastically simple way. And if you understand this, it can completely revolutionize your practice and how you work on clients. Somebody texted me. Give me just 1 second. I want to make sure that they can all see me. There we go. Yeah. So I do have my phone with me. If you want to call, totally fine. I'm not going to be able to hear you, by the way. Only I'm going to hear that. If you just want to text, that's also completely fine. Those questions, other than not only do they not annoy me, they actually give me more information about what I'm doing to be able to like give you a certain camera angle, show you what I'm doing. So from here, here's what's going to happen. I'm going to put this here. And then I want to open up those areas I talked about. This happens to me all the time, okay? I'm going to come up and around, and it's almost like I'm going to use her arm to anchor this in position and just create a little length here. I want to do this so the arm is comfortable. And I'm just starting to push down. I'm lengthening that levator scapula, lengthening trapezius, the upper traps. How does just that part feel? Good. The client, tells me that feels good. I'm trying to establish some touch contact with the client because I'm about to interact with their body differently, okay? So from here, I might grab the arm and go, listen, if I roll you back and open, how does that feel? Okay. Do you prefer this to the first thing I did? Okay. So she prefers that. What I'm going to do is slightly change things, because if that's what she likes, then I want to focus on it and see if I can shift a little bit. I have shoes on, but I made sure to wear shoes that I can slide off easily. Okay? I've got her arm over the wrist. I'm not like separating the wrist. I'm just using her arm as a handle to be able to reach all those muscles, to be able to reach the pecs and pull this open. But in my case, I'm going to slide my left foot out. I'm going to put it right along the sacrum, because I'm trying to let her know she's not going to fall off the table. So, like, more to the back or a little bit down? More to the back, like this? There we go. Now again, I'm right over the sacrum here. I'm just creating space so I can roll her back and open, okay? Most people are totally fine with me doing this. It feels comfortable to them. They might never have had it, but I'm going to switch it up, and then along the back here, okay? The size of my foot means that the ball pad can essentially walk right along the spine. This is just a movement. It's not deep pressure. I might even get to the shoulder blade right there and start to pull her open from there. And she, again, knows she's not going to fall off the table because I've got my foot in position. Now, doing some of that would give me a chance to discern, how far the client's wanting to go, if that makes sense. I have a tendency, in the intro Thai workbook, I talk about general to specific, superficial to deep. That happens with the intimacy and touch that we have as well. When I'm working with somebody completely new, I'm trying to establish rapport with the client before I do things that are maybe more physically intimate, because I'm trying to establish trust. They've never, worked with me before, right? So now that I've done all of that, you tended to prefer kind of like back and down. Okay, so now what I'm going to do is this. I'm going to change the body mechanics here. I'm going to set this down again. And I want to make sure that there's enough space on the table for me to get one leg and my keister. I'm usually going to sit, in my case, because of my arm length, about at their sacrum. So I'm going to come up and I'm going to bring my leg up. Now, what this provides is this big barrier here. She knows she's not going to fall off the table because my leg is blocking this entire piece, right? Now, this passive body contact, I know that I've worked with you before. Mm-hmm. When you do this with clients, how do they respond? Yeah, they don't notice. No. For some therapists, passive body contact is kind of a weird thing. In some schools, they're teaching them, not to do that, and I think that's a real failure in education standings. So what I'm going to do is this. I'm going to reach down, and I'm going to grab hold of her shoulder, and then allow her arm to drape over my forearm. Now, depending on my body size, and depending on the size of the client, I might have to sit further back. I might have to scoot further forward. For me, this usually provides this barrier because she knows that when I pull her back, she's not going to fall off of the table. So when I'm coming in here, I'm pulling her back and open. My leg is here as a barrier. She's light enough that I can essentially just start to lift her onto my leg. Lift her up and over, okay? Show this from different angles so you can see this. You can do this repeatedly, low and slow. This is, if you only got one move out of this whole thing, this would be it. Just this can change your clients' lives. Because I'm using movement to be able to access those tight muscles along the spine. Now, what I'm also doing is I'm not compressing my hands. I'm not compressing my carpals. I'm not compressing my phalanges and my fingers. What I'm doing is tractioning. How's that? So I'm going to give her a choice. I'm going to go kind of like straight down or back. Okay. Now, what if I go at like a 45-degree and a little bit of both? Now, I gave her a choice real quick. Vectors and angles. Was it straight forward? Was it back? Or is it back and to the side? When I go back like this and to the side, I'm thinking pec minor. That's what I'm lengthening, right? But she's protected here. She can't fall off the table because I'm in a position where when I pull her back and open, she's on my leg. She knows that I'm protecting there, blocking, right? I can lift her completely. She just comfortably rolls her head down and over. I can start to play with this movement as I'm lengthening all of this stuff in here. Now, when I bring you back up and over, I'm going to give her a test, kind of range of motion. I'm going to bring her up and over, and I go from here a little bit down, a little bit to the back. A little bit to the back. What do you think, right there? Now, when I bring you to your edge, do you mean to kind of rock at your edge right there?
Yeah.
Kind of invite your edge. There you go. Right there. And I'm going to bring her just back to neutral, back onto the pillow. I'm going to change my angle just for a second. I'm going to come up, and then just that little bit, like, how does that feel? Lengthens all the brachial plexus. Lengthens all these muscles. What do people do all day? You seen this guy at the grocery store? What do we just do? If I have Carl on my table, what I do is I don't completely degolem him because it'd be too much, right? What I do is I invite him a little bit open, invite him a little bit open, and invite him a little bit open. And when we're done, he's like, oh, my back feels so much better because these muscles are tight and rolling him down and forward. Again, these muscles, pec major and pec minor particularly, it's pulling the shoulder blade. It's pulling the chest down closed. When the chest is pulled down and closed in thoracic flexion, how's their breathing? More tendency, I would say, towards anxiety and depression. When they do a deep back bend, like the young lady on the right, what happens? It reverses the very thing that the clients are coming in for. We're trying to get rid of thoracic flexion as a constant state daily and create thoracic extension. We're trying to open up through the chest, and then we were also able to lengthen the levator, scapula, and trapezius. Those two moves look inordinately simple, but that is amazingly complex work, and it goes a long way to helping people in chronic pain that you're having problems with. You just can't deliver enough pressure into their rhomboids and into their paraspinals. You can't even deliver enough pressure into this, and here's why. This isn't the problem. The front is the problem. And we're lengthening the front and pulling them back and open. They feel pain back here, but the reason they're feeling pain back here is because of the action of pec and pec minor. I'll bank on that. You want to argue with me, talk about pain science? Let's do it. Let's go to town. So I'm going to go back and in for the same basic thing. I'm just going to go for a second pass, okay? So I'm going to lift her arm. I'm going to come back in. I'm sitting almost at her sacrum. Then I'm going to grab right here and pull her back and open. How's that? Good. Now, since I've got a good grip here, we pulled her back and open. What I want to do now is I want to put some pressure in the muscles that people always talk to us about, which is like the rhomboids and the paraspinals. Too tender? Been working out? Okay. So what I've got is a couple of stacked fingers. Now, I'm not, no. What I'm doing is I'm stacking these and I'm pulling her into my fingers. Pulling her into my fingers. I'm right doing like cross fiber friction, right at the paraspinals. Right at the paraspinals. Right at the paraspinals. Right through there. Right at the paraspinal. Right at the paraspinal. Right at the rhomboid. Ooh. And then my fingers, oh, they get a little tired. So what I'm going to do is put my hand aside and give her some more little traction. Switch it up. Because I don't want to do something that bothers my hands at all. I'm really hooking. Ooh, where is the tense, dense, tight tissue. What makes the client go, oh, that? Because that's where the tips are. Oh, that's where the pain relief is, right there. Right there. Right there. Oh. And that big, long lengthen again. Big, long lengthen. Pulling her back and open. So what do you think? You want a little pressure right here? Kind of at the top? Okay. Yeah. So when I come in here and I want you to see this, I want you to watch this first before you do it, okay? We have to be able to do this stuff safely. And one of the things that I do is completely fuck up your table routine. If you are fixated on working on a massage table, I'm going to completely roto-root your entire practice in the next 6 months. In the best way possible, by the way. Because I'm going to save your hands, you're going to make more money, and you're going to help people effortless. And if you think it's not possible, I do it. And I wear an Easy E t-shirt while I do it, all right? And I drink from a Neil deGrasse Tyson cup. So the deal is, she wants a little pressure right here. I could come in, create some length, and use my forearm and elbow. Now look at my body mechanics. What do I have to do? Look at this. Look at this. Every time I go down, what posture do I create? Thoracic flexion or thoracic extension? And you know, recreating the posture that clients have that they come in for. Okay? So the deal is, when I'm coming in and doing this, I'm going to free up your hands as much as possible. I have dropped this table inordinately low. This table is just about at my knee. You probably see it just about at my knee, okay? For you, the height of your table and what the table allows may be a little different. But what I'm going to do, and I want you to watch this, is I'm going to bring our arm like this, and I've got this big handle along the deltoids and along the arm so that I can mobilize all of this. For me, it worked a little bit better if I hooked just a little bit above the shoulder. How's that? So she's got her head turned to the side. There's some space right here. What I'm going to do is this. I'm going to bring this arm up because I've got her stacked now. I want to make sure the arm feels comfortable. When I push like that, it feels good? The grip here is okay? Yep. So I've created some space, and here's what I'm going to do. How's that right there? Yeah. Now, I have to stack body weight with my hips to my knee in the same way that you normally do from your shoulder to your elbow. But I get to change the body mechanics so that this works for me. I'm in the posterior, okay? I'm not on the carotid. I'm not in a position that's uncomfortable to her, okay? I'm saving my hands simultaneously. Because my hands are now free, I get really great options because I can grab this shoulder, start to lengthen that away. Think down. Okay. So instead of just down, can I go down a little bit to the back? Is that better? Yeah. Okay. So if I go down into the back, what happens if I grab onto the forearm right here? How's that? So now I got 3 points of contact. You ready? The knee is primary. This hand is secondary, and this is tertiary. You're going to see this pattern again and again and again. If all you can do is this, how's the pressure? How's it when I rock? Now, do clients, if they've never seen you before, you've done this stuff, do the clients know right now that you're using a knee? Why? Because they assume it could be a forearm or an elbow, right? Now, the thing is, you have to be aware of like cultural context and who you're working with, okay? So I'm going to grab this arm, pull her down and open. How's that? Better. With the shoulder to the front or to the back? Little rock there. Totally frees up. My hands are just doing a little work to like lengthen the shoulder there. The big guy, bigger tools. Knees are elbows on steroids. Knees are elbows on steroids. Now, I'm going to give her a little bit of a break. I'm going to come off just a second. You could probably see just this little bit of like therapeutic inflammation she's got right here. Is it easier for somebody to take a big knee or an elbow? General to specific, superficial to deep. Then I could now come in and put some pressure here because this is going to be more spot specific. I could, lean to the back, lean to the front. These are all options. And in fact, for this class, what I am going to do is I'm going to change the position a little bit because I want to come into the posterior cervical spine, into semispinalis capitis, and into essentially the suboccipitals. I want to be able to hit these muscles in the back, in the posterior chain. This is not all the muscles, by the way. Tons of little muscles controlling every little movement of those vertebrae. Usually so I can turn around and look and go, how are they doing? That's when I use them. So I'm going to change my position to be able to come into this. Now, her head generally needs to be at neutral. Whatever bolster I've got, she needs to be level. If I have her head lifted high, it creates this situation where if she's up like this, it's like there's no space to press into. If I have her at neutral, I'm also going to do the following. To create a little bit more length, I'm going to bring her head forward. And what that does is it gives me a little bit more space at this posterior portion of the neck. And you can see that because her head turns down a little bit towards the table, I'm able to access this posterior piece without fear of getting in front of the sternocleidomastoid and the carotid artery, which you don't press on, right? People would faint. But that's in the front, above, in front of the SCM. I'm going to come to the posterior, and in my case, I think what I'm going to do is I'm going to grab here to open this, and then I'm going to come in from behind. So I'm doing this to pull her back and open. I'm going to lean here. Now, when I hook at that lower portion of your neck, do you want me to go up or down? What's up? Do you want me to go a little further forward or a little further to the back? Forward. It's still up. Not too much. What about when I rock the shoulder? This is primary. This is secondary. This is the primary piece. Some people won't like the rocking. Some people will like static pressure. I'm going to bring her arm up a little bit so I get a better grip. I'm going to go just a little bit higher, more towards what you think of as the base, towards more like the suboccipitals. Oh-wee. A state of oh-wee was declared. Is that too much? Down or up? Right there. When I go down and hook right there, more to the back, more to the front. Right there. Now, just localized sensation, or are you having referred pain? In other words, you don't feel it running anywhere.
Yeah, no.
So you can see that I'm bent over again, right? I'm in a position where I was leaning just because I'm working on a table, which for me is totally weird. I don't even own a table. So, good question. So here's the deal. Am I using this meaty part of my forearm or my ulna? Meaty part of the forearm or ulna? General to specific, superficial to deep. You guys know, you use your forearms. You could come in on the meaty part and then turn it, and then they go, ooh, like it went from green light to yellow light. Any of that's going to work. You also want to make sure that you're not straining. And I'm going to show this from a slightly different angle because I want to change the body mechanics. You noticed when I came in, I grabbed the shoulder, right? What did I do? I'm leaning over again. This is why I have some fundamental issues with the cultural constraints that the table presents. And I'm teaching table in almost every class for the next 6 months, by the way. Because you got to know. If you understand mat work, this shit breaks down. But I want to change the body mechanics so I can rest and deliver what we're doing. And what that is for me is the following. I'm going to go ahead. Can you lift your head for me? I'm going to scoot the pillow forward a little bit because I want a little more space over on this side. I want a little more space right here. I'm going to come in and see if I can sit, okay? And then I'm going to prop my arm like this. Sometimes I like my passive hand to be this way. Sometimes I like it down. It really depends on what's going to work best for you. But when I come in and do this, what do you think? Right there? Okay, now up. Now, this is my preferred version. There's nothing wrong with the first one. But this, as Eazy-E would say, is gangster. Because this is easy. This is the seated version. They have no idea what I'm doing, by the way. They don't really know what part I'm using. They don't know what's going on. We've only worked one side. So what do you think? A little more up? You're thinking to there? Now, a little more to the front, a little more to the back. Okay, a little more to the back. Right there. Now, you want to make this as easy as possible. You don't want to strain. You don't want to work hard. You want to hang out. Think pina coladas and a hammock in Hawaii on the beach underneath the palm trees. I mean, they're dealing with some major stuff, but we're getting paid to hang out. And that's what I like, right? So my body position is relatively relaxed and neutral. I can even do the following if I'm really showing off. They don't know what I'm doing. They're like, do you need more pressure? Okay. How's that? But I get to open my chest and stretch, and I go, oh, okay, I'm just gonna, how's that? Let me see if I can get this from a different angle. Oh, we're gonna get the open. Now, I'm gonna lift up, and I'm gonna go just a little bit higher, right to her suboccipitals, right into the base. And I'm gonna show those again, just so you can, again, think about where we're pressing. We're getting up towards the base of the skull there. This is a little bit more my ulna. It's a little bit closer to my elbow. I'm able to press in right there. Now, what do you want? Do you want a little bit up, or do you want a little bit down? Okay, so a little bit up. Tell me when. Right there. All right. So to the back or to the front? Front, right there? Yeah. There we go. Now, I would never encourage you to use your phone while you're working. But if you wanted to take a selfie for Instagram and then like tweet it out to Ice-T on Twitter, now would be the time to do it. Hands are free. This is what I'm teaching you, and this is why it's so profoundly effective. The clients do not tell me this is ineffective. They're like, dude, this is amazing. Why doesn't everybody do this? And I'm like, tough question. So a little more to the front, right there. Are you dying? No? Any referred pain or just localized? All localized. This feels intense. Mm-hmm. So pain, we back off. Pain, I use less pressure. And when it comes to using less pressure, this is what it looks like. Are you ready? If I'm gonna lean back off, that's not a big deal. She's saving me. I go, hey, right there. Is that better? Or do you want a little more? Because you saw the shift. It's real subtle, but look at it. Right here, right there. She wants the second one. But do you see the shift? Just slight change in body positioning and mechanics can make a huge difference. I'm going to back off slow. That's a deep compression. It was closer to my ulna that time, but we kind of built up to that, right? I'm going to come back up, and then I want to go ahead and grab her arm here. And just kind of like I started, I'm going to roll her back and open. And this feels much more fluid to me, by the way. This feels like there's no resistance. It's just easy for her to do. I'm going to do my thing again. I'm going to slide off my left shoe. I'm going to put it right here at the sacrum, and I'm going to roll her back and open. Much when I roll you onto the pillow? What do you think? Pretty good? You say yes? Now, here's what I want to do. I want to slide my shoe back on, and I want you guys to do this at home, by the way. When you're working with us, I absolutely want you to do this right now. Now, go ahead and sit up for me. I'm just going to grab the blanket because we're going to reuse that when we turn it on the other side. Because all we did was work on this side. Now, how does that feel? What's the difference between what you feel on this side now and this side? And then generally, like, what's the sensation difference between the side we just worked and the one we didn't? Yeah. Now, do you typically have more problems with your right side? Okay. Now, usually, and I didn't mention this before, usually I would be in a situation where I would ask the client if they had problems with the right side, I'd work on that side first. I'm always going to go where they got a problem. But I like to do one side and give them a chance to, like, check it out, see how it feels. Because then they're in a totally different situation. Now, let's say I just worked on the problem side. This happens for me all the time, okay? I worked at a chiropractor's office. I'm changing things very rapidly from what they're used to when they think of a standard massage. I'd say, listen, Andrea, do you want to keep doing what we're doing? Or do you want to take your top and bra, lay down face first and face the rest so we could do Swedish and deep tissue? Now, 9 times out of 10, the client would be like, no, this is really good. Can we do this? And I go, sure. Go ahead and turn over for me. And you guys are going to follow along at home. You just flip into the other side. I'm just going to support her with my bolsters here. Oh, there it is. No, it's fine. I forget where I put things. So all we did is just change her position so we can put the bolster in position at her hips so that she can let her leg go. I'm going to repeat what I did on the opposite side. And again, what do we get into and pull on? Traps and levator scapula on one side. Then we wind up opening up the pec major and minor. Then we're putting some pressure eventually into the neck muscles, the posterior cervical spine, which includes semispinalis capitis and the suboccipitals. When we talk about back muscles, inordinately complex. They're just layer upon layer upon layer. I want you to understand that the tools that I'm giving you can be used on most of those posterior cervical spine and most of the posterior, that back chain, the paraspinals. Anywhere in the back, you can use a lot of the same tools, and I'm going to go into that over time as we go through class, okay? So I'm going to go back into this position because I want to open this up again from the opposite side. So I'm going to come down and over. I'm going to put this guy over here, I guess, maybe over here. And in her case, can you scoot just a little bit that way? I wanted just a little bit more space for me to sit, okay, when I get ready to do that. But from here, I'm going to be able to take off my right shoe now. I'm going to slide that guy off. I'm going to put my foot right at the sacrum. And then I'm going to slowly pull her back and open. You know, she's not going to fall off the table because I got my foot there. If I want to take pressure off and kind of rock, if I want to work up the spine, totally fine. Big, broad ball pad of foot. I can hook just below the shoulder blade. How's that right there? There we go. You prefer that to down at the sacrum? Yeah. And go back to the sacrum. I'm going to pull her back and open. And again, this is why I wear shoes like this, that I can slide on and off real fast. So as I come down, I want to be able to get into position so that I can sit, again, in my case, right along her sacrum, right here. And I'm going to bring my leg up. And when I bring my leg up, it means that there's this nice boundary. When I pull her back, she knows she's not going to fall, off the table. I'm going to lift her arm, reach under, grab right here, lean down, lean back. Which one did you prefer? Both. So she kind of wants both. I think it's going to happen again, but I'll test it. I'm going to go about 45 degrees. What do you think there? Yeah. Now, I'm lifting her, okay? I don't mind all this stuff at all. Like when I lift her up and over, here's the other thing. We've been working now. She knows me a little bit better than when we got started. The clients don't care. They know it's my leg. They can feel what I'm doing. Rolling her up and over. Rolling her what? Back, up, and over. Is it too much when your shirt slides there? No. Okay, just making sure. Occasionally, just be careful. Occasionally, sometimes when you're doing this, the seams on the shirt, you don't want that to like dig into the skin. You can always just ask them, some material like the texture of clothing will be different. I'm going to grab here again, roll her back, up, and over. Like I'm dead.
Yes.
I can't take it. She's dead. I'll show it from this angle. I can rock the shoulder blade. I can work right into those paraspinals. Come right into here. Just hooking the fingers. These guys aren't digging. These are planted, and I'm rocking her into my fingers. Rocking her into my fingers. Rocking her into my fingers. Get in right there. Oof, dying. Get in right there. Rocking in right there. And I know everything is going great because nobody's texting me. Everybody can see it, and everybody got no questions because this is far superior to my in-person classes and 75% less. Right here. Ooh. Right there. Yeah. Right there.
Yeah.
Right there. There. Now I'm going to back off. My hands get tired. Condition yourself. Back and over. Back and over. I'm going to give her just a second to rest. I'm going to check and make sure I didn't get another text message. Cool. So from here, we open that up. We press into the shoulder blade. We've kind of addressed what the client came in asking for. They were saying, hey, I got upper back and neck. And maybe she has it more on one side than the other. I do want you to do both because I want them to be able to compare and contrast what's normal and what's the side that bothers them and what's the difference in sensation. They have more of a baseline to make, judgments. If I decide to give some pressure, you think right there? Okay. So I'm going to try to figure out what camera angle is going to grab this the best. Again, I'm going to show this the first time. This is the second time we've done it, but it's going to be with my opposite knee this time. I'm going to come in, see if I got a good handle here. I think I do. I can roll that back and open. Then I'm just going to stack myself. I need to be able to get close enough so that I can get my knee in here comfortably. It's right at the top of levator scapula, that cervico-thoracic junction. So I'm going to lengthen this down, bring the knee in. There we go. Change camera angles there. How's that? Dying? No, she's not dying. Now, when you're looking at angle, look at my hip to my knee. When you're looking at angle, when I'm using my forearms or elbows, look for my shoulder, elbow. A knee is an elbow on steroids. I'm going to press this down. You think a little bit to the back. There you go. More pressure or less? More. Okay.
Yeah.
She wants more, so I'm gonna have to change my body mechanics. I'm gonna do this. I'm gonna bring this foot in just a little bit because I'm trying to stack my body weight up so I can come down. I'm gonna see if this will give the pressure she wants. How's that there?
Yeah.
There we go. So it's gonna take time for you to learn how to position your body to be able to deliver pressure right there.
Yeah.
Well, how is it if I lean? So this isn't my hand doing the work. This is my hips. I'm leaning with my core right into there to give her what she was looking for. Right, in, here, right, in, here, right, in, here. Yes, yes. Oh. And to the back. Now, if I want, and I feel like I've already got an opening, can I switch hands where this left hand is here and the right hand's on the forearm extensors? Because now I got multiple points of contact. The knee is primary. This hand is secondary. This hand is tertiary. These other 2 points aren't as important, but it does feel nice. Oof. Yeah, oof.
Yeah, pretty much.
You learn how to feel with your knees real fast, just like your forearms and elbows. Almost dead. Nice. I'm not dead yet. Pop culture references abound. Too much. More to the back, more to the front. To the front right there.
Yeah.
There we go. Now, could I do the same thing? Let's say you're not comfortable with this. Can you do the same thing with your forearm? Sure. Sure. Feel free. But once you learn how to use the knee, save your hand. Deeper, more effective for the clients. Bigger, broader tool. Right there. There you go. And I'm going to slowly back out. Give her a little space. She's dead. We are killed her. So I'm going to come back and in just to deliver a bit of that pull again. I'm going to come sit here just for a second. I can bring my leg up if I want. Because we did a big compression. And sometimes it feels nice to just mobilize after that. The mobilization feels a little more friendly. The compression can be intense at times. And you got to find like a balance between push and pull. Compression and mobilization. Compression and traction. So I'm going to bring her head up and forward just a little bit. I want to make sure she's stacked well with her pillow, like she's got some head support. And I want to be able to come into the posterior cervical spine. Okay? I want to be able to get into those muscles, be able to press into semispinalis, capitis, levator, capitis, suboccipitals, tons of stuff. You're still also hitting what? You're still also hitting trapezius and levator scapula on the way up. There's so many layers of muscle. Count how many times somebody's asked me, like, what muscle are you working on? And I'm like, I don't know. But they think it's like I don't know, and it's like, well, there's so many layers of muscle, it's hard to differentiate exactly where one ends and the other begins. So from here, I'm going to go ahead and come on up. And again, I want to be in this posterior, in the back. You don't want to be in the front, not in front of the SCM, not in front of where carotid is. You want to be in the posterior. So I'm going to bring myself up. Now, I did this from that like leaning forward position before. I don't like that one as much. I just showed you because I'm trying to help you adapt your table practice rapidly. I'm going to come in from here. And again, I'm going to have this receptive palm here. I'm going to come in and see if I can find a spot more in the base of the neck here. Much right there. I'm kind of kneading because I'm trying to feel soft tissue. Don't want to be on bone. Right in. Okay. Now more up, more down. I'm going to hook right here. I'm going to shear. When I say shear, I'm not really gliding. You could, but generally what I'm doing is like I'm grabbing a section and then rotating it over. There's some grab and then some shear. In this case, I'm leaning and then going up this way, right into there. Okay, now more to the back, more to the front. There you go. And I don't make any judgments for what she wants, by the way. Doesn't matter to me. It's just as easy to deliver. What I'm going to do is always, you're going to stack body weight and make it as easy as possible to deliver. You want it to be easy. You do not want to work hard. You want to be effective, but when you're effective, guess what? The most relaxing work ever. Easy, soft. Communicate more in the work I'm teaching you, especially for chronic pain management. The person could just almost go to sleep. But for the most part, I do kind of ask them if they're having a problem, I'm getting feedback and information from them to be able to deliver pressure in a way that's going to help them with their pain. So from here, I'm going to lift up just a little bit and go a little bit higher. I'm a little closer to the ulna now, a little closer to the elbow. Right there. Okay. More to the back, more to the front. To the front, right there. Now, as I'm flipping camera angles, let's just try to give you a sense of the movement going on. This stuff from the outside, in my opinion, completely boring. Boring. I mean, who cares, right? I mean, this was Thai massage. You got to do crazy, contortionist stretches. No, not at all. Some of the best work is inordinately simple. Inordinately simple. Somebody's like, I have headaches, this. I have upper back and neck pain, this. Stretch? You're not going to stretch chronic pain away. Compressions and skin stretch. Those are interchangeable words, by the way. Are some of the most potent tools we have in our practice, and it deeply communicates to that person's nervous system, provides a stimulus, and gets their nervous system hopefully to respond with relaxation. Unwind. Right there. More pressure or less? Okay, so just like with my knee, right? I'm just going to stack a little bit higher so I can lean right in. Are you dead? Almost dead. Not dead, dead. Now, a little bit more to the front, a little bit more to the back. Okay, or do you prefer when I go back and forth? Okay. Now, you'll see that I just gave her some options. It doesn't matter to me what she likes. In other words, it's an open choice. It's not really any more work for me to deliver one or the other, but for her, it actually feels more effective. And that's where I ask for feedback. Some people will say, nope, just like, can you hold that spot? And I go, sure, right here. And then in my case, I'm like, oh, okay, sure. Do you want a little more pressure? How's that right there? Because my neck feels, I don't live in that hand. Thoracic flexion. Right in there. So it's very common, the models I work on, I ask them a question and they don't say anything. And it's because they fall asleep or they're just so it can be very intense. Don't get angry or frustrated if clients don't answer you. Sometimes it's like I call it falling in. Like the sensation is so intense, it's like I get lost in. So I'm gonna lift up just for a second, give her just a quick break, and then I'm gonna go for that last pass that's a little bit closer, right up to the suboccipitals, right at the base of the skull. Usually on most people's necks, I can grab 3 or 4 spots along the neck, and that's usually like a pass instead of just effleurage where I start at the base and slide all the way up. I find this to be very effective for people. So from this angle, I'm going to come in again right at the base of the skull. So more to the back, more to the front. Now, do you want to move or just be static? Back and forth. And this asking the client for feedback, here's what it did. One, I could really hone in on pain and what their sensations were. The other part was it created a client who was more willing to engage with me and participate in their own wellness, participate in their own health. It got to the point where the people preferred what I was doing because they could put themselves in a situation where it was, we always found the spot. Because I was asking for, like, right here, like where, like, ooh, how's, oh, right. Oh, can you lean in right there? Eventually, when they're trained, they're like, hook into the spot. And can you shear down? And I would shear down, and they're like, oh. But together, that was a much better session than me just delivering the massage as a service provider. It created space for me to really be able to work on the person in a way that was interactive and really promoted their health and wellness first and foremost. It also gave me a lot better pattern recognition for what was going on, and my capacity to serve the next client and the next client for years to come improved. You'd start to see patterns in upper back and neck pain that you could help people unwind. A little bit more to the back, more to the front. It's just the slightest lift and shear. This routine came from my time at a chiropractor's office. I became a brutally efficient hitman when it came to pain. Like, they came in and I had 30 minutes or an hour. They'd say, what kind of massage do you do? I'm like, wrong question. Where do you hurt? And the reason is because I was redirecting, like, nope, let's get started. And here's the thing. I used less sheets. I didn't use as much cream or oil. They got more time because I didn't have to wait for them to undress. And as a male therapist, it created space where women were more open to working with me because they didn't have to undress. It created more comfort for a broader range of people to work with me, and it helped me seal my focus towards chronic pain management. A little bit more to the back, a little bit more. Localized, or are you getting referred pain? Up in your head where? Kind of in the front? At your crown? The halo where it blew out? Always nice when we can reference Joseph Campbell and the crown chakra from Indian mythology. It's also the halo in Christian mythology. Oh, you don't think they're the same thing? Okay, that's fine. Next. Now, from here, I also want you to think about the fact we have worked almost an hour. I have not put the person prone once. I have not put the person supine once. Side lying is the primary position on a table that massage therapists are not using, and it's hurting your practice. Upper back and neck pain, this is always my go-to, first and foremost. Always. Very rarely do I put people prone and supine, depending on like what's going on. Doesn't mean I don't ever use it, by the way. I'm just saying I want you to add side lying into your repertoire. So more to the back, more to the front. Okay, not too much, just tender. And then if I did this, I'm gonna do this. Or if I give you a little more point, is that too much? Okay, is that what you want? You think so? Okay, she's questioning, so I'm not gonna give her any more. She's like, yeah, maybe. So right there, how's that? There we go. And that angle and leverage, you guys use this all the time. You're used to changing the angle of the ulna, the forearm, the elbow. You guys are used to this, right? A little more to the front, a little more to the back. The best work, amazingly effective for them. Here's the second piece. You always want to do work that's effective for the client. Now, what can I do to ease my body strain as much as possible? When I could do both, I was like, go teach that. Go teach that. Effective and amazing for the clients, easy on my body. Go teach that. That's what I teach. And that's what I'm going to be teaching you for the next 6 months online, 6 hours each month. Just like this. A little more to the back. Right there. Ooh. Ooh. Yeah, I mean, it feels like I'm right with the suboccipitals, right up at the base. Right? Almost feels like I'm getting a little bit closer to the spine itself, just like almost like I want to call it a chunk of muscle, but it's just some dense muscle that I feel right in there. Now, these compressions are deep, and one of the things I'll tell you is as the compressions get deeper, I want you to back out very slowly. The way that I'm going to come out is I'm just going to slowly lean up. It seems to be, it's almost like if you jump out, the tissue recoils. It can feel uncomfortable to the client because it's such a rapid release. Now, I'm going to go back to what I started with, okay? I'm going to go ahead and take off my right shoe. I'm going to brace right at her sacrum, right here. I'm going to roll her back and open. That could be right along the spine, the paraspinals with the ball pad of my foot. There. There we go. You like all that, huh? Now, I'm going to give her a second. Now, if I had been at the chiropractor's office, I'd say, listen, go ahead and sit up for me. I want to see how you feel now. Cool. She's relaxed. One of the things that I've found really interesting is people would kind of debate, you know, is the work more or less relaxing than like Swedish, like effleurage based stuff? And I think it really just depends on the client. Kristen works on me and I'll often fall asleep, kind of fall in. I find it deeply relaxing, but I will say this. I think it's superior for pain relief and mobility. Those two are what I see consistently, and that's really what I try to seal into my practice. It's really what I use in my marketing. It's talking about the fact that it's more effective for chronic pain and mobility. Those are the clients that are my bread and butter. So I really tried to skewer that marketplace by using simple techniques. Again, amazingly effective for the client and easy for me to deliver. We're going to take just a quick break, just a minute or two. We're going to give you guys a chance to go ahead and go to the restroom. Then we're going to go ahead and trade out. We're going to repeat that same basic stuff, maybe with a little more nuance because she'll be receiving for the second time. But we're going to go over the same basic thing twice. We're going to have about 30 minutes each side. You guys you guys go ahead and take a quick bathroom break. We'll be back in just a minute. So what was going on? What you said with the side of your neck there?
Oh, just how tight it was.
Yeah.
Oh, from driving.
Yeah. You just didn't realize it was that tight. Yeah. Yeah. And a lot of clients too, they might not be having severe chronic pain. They might just have, if 10's hospital and 0's no pain, they might be at 2. It's just something that's kind of annoying, but it doesn't like prevent them from doing things in their daily life, right? Yeah, I'm gonna redo it. I gotta walk them through. So one, whatever bolster they have on their neck, you generally want them to be at about neutral. You don't want their head craned up real high. You don't want it lengthened down and completely over. So for instance, if I didn't have this, I'll lay your head down. She's so pulled over, it's like this big length, right? Generally, I want them to be at neutral. And I think that's about neutral. And also, when I deliver some pressure, it sinks in just a little bit. So she's got some cushion and support, but it's not such that she's like in a position that makes it harder to access those muscles. The other thing is, if I didn't give you a bolster at the hips, how does that feel to you?
Comfortable.
I think what I do when I receive is I feel like I'm holding some muscle tension without thinking about it to like keep myself in position. And what I want to do is I want to go ahead and roll this up and then provide that under her hip so she's got more of a bolster, more of a hold there. All right. So we're about to go back in, just making sure people texting. Need a little bit more tea, so I'm going to get hoarse. Oh, allergies. Yeah, no, we get past COVID, and then it's like allergies kick us in the face. Great. Thanks. Thanks, nature.
Wonderful.
I'm going to, again, in my case, I'm going to slide off my left shoe. You could do this with either leg, by the way. In my case, it feels like it's a little more balanced to use my left because my body's higher, meaning up towards her shoulders. I'm going to slide my left shoe off. I'm going to put my foot right at the sacrum right here so that I can roll her back and open. And that foot is just making sure that she doesn't fall off the table. She knows that she's supported. It's also anchoring the hips forward so that when I do deliver pressure, she can feel a little bit more of a twist. Now, I'm going to walk my foot just up the paraspinals. This feels pretty open to me. I'm not feeling much tension in the lumbar spine, but once I get to the thoracic, I feel a little bit. Both just below her shoulder blade right there. Now this is mainly, in my opinion, even though we're in the back, what are we doing? We're pulling open pec and pec minor. That's primarily what I think is going on right here, is we're lengthening and pulling that stuff open. Pulling open the chest. Shoulder blade go there. Now that I've done that several times, I've gotten the person a little bit more comfortable with my touch, like how I work, a little bit of mobilization. This is where I'm going to come in and make sure I have enough space. In my case, again, I'm going to sit just about at the sacrum and then bring this leg up. I don't have to take my shoes off for this. Then I'm able to hook around the shoulder here and then slowly start to give her some lift and pull. Now I can bring you down or I can bring you back. Or do you kind of want both? Like I don't know because we just did it.
Right?
Okay. Now in this case, also, sometimes I can get a little bit more depth. You know, we're going to give you some variance. You know how I was using my fingers to hook into the paraspinals here? Do that again. Right in, paraspinals, right there, right there. In, right there. If your fingers get tired, what do? You back off, take it out, bring them in for another long lift, twist, stretch. And I also want to be very clear about this. So as you learn to work, you're going to do work that's optimally effective for the client and does what? Eases your body strain. So why don't you watch this? I'm going to lean back. She doesn't know what I'm doing, but I'm going to pull my shoulder blades open, head back. Now it feels deeper to her because it's more body weight, but I'm getting a chance to lengthen and mobilize my own neck at the same time. I go, okay, a little more left. Oh, right there. A lot of therapists spend all the time pushing, compressing. What I'm trying to do is get you to balance, push and pull. Back and over. How's that? I'm going to go back into, right along her rhomboid. Right up in here. How's that? You're like, it feels like death. There. There. Right. There. There. Oh. Oh. Pull her back and over. Big pull and over. Now, I see some people do this all the time. They'll kind of like hook the fingers. And one, I don't think it's bad. Like this feels nice, right? But wouldn't you prefer if I came up and put my knee in here? Bigger, deeper compression. The other thing is, I'm going to get you to long-term save your hands. What I might do is use my fingers to kind of feel a little more perception, a little more detail, right? Like what feels tight in here? Pull it back here. This stuff, this is okay. This is all right. There's some movement here, a little more pliable. This is how I use my hands. I don't use fingers to do the big, heavy lifting because I have an elbow on steroids. You're gonna go to sleep? Probably. Oh, that's what y'all call it. Kristen and Andrea call it, no, we have to come learn, meaning Robert's gonna work on us for 3 hours. It's part of our learning process, Robert. So to mix it up for a second, I'm gonna stand up, I'm gonna come up and over, and again, I'm gonna show this because I know that now you guys have switched, okay? You guys were receiving before, so it's a little harder to pay attention. I'm really going into top portion of the trapezius, the upper trapezius. We're lengthening that stuff down, just like on the right side. And it's really getting to that insertion on the scapula, on the shoulder blade of levator scapula. That's really where our knee is going, is that cervico-thoracic junction. And the way that I'm going to do that is, I want you to watch this first one. I'm going to stack her arm, maybe like this, maybe like that. I just want to be able to lengthen this down, and I get a little slide on her t-shirt. So I find that if I grab just a little bit higher right there, I got a little more grip. How's that? So watch the first one, and then you can come in for the second. I want to figure out, because I was down here and I couldn't quite reach. So I have to come a little bit over. There we go. How's that? Not too much pressure. So you guys see that I'm in the posterior. I'm in the back, okay? Up in the front, not in the carotid, not in the front there, not in front of the SEM. This stuff is definitely in the posterior, and I'm able to lean in, okay? Now, if I'm coming out, I'm gonna back out slow, but I can use that to create a little space in there first. So my target is a little bit broader. So that second pass, I want you to do this one, okay? I want you guys to go ahead and lengthen down and then come in. And you're gonna stack your knee. You're gonna stack your patella. You're gonna stack so it feels comfortable, okay? You don't ever want to feel like you're destabilizing your kneecap or, you know, if it's uncomfortable, just like your elbow, can you change angle? Yes, absolutely. The angle that you see is from my hip to my knee. My knee, elbow, steroid. Now I'm going to switch hands and put down that on the shoulder, and then I'm going to reach down into the forearm extensors. What do you think? A little more to the back? I hold right there. There we go. And my right leg is really kind of leaning into the table right here. I'm really leaning into this table to give me some support. And a little bit of rock. See, you prefer that? A little more pressure. There we go. More to the back. There we go. All good. Really, really great work. Super effective. Super easy on your body. More to the back. It was just a little feedback from her. Just a little bit of additional, nuance. I could do the work without that. I could just let her go to sleep. I don't find it to be as effective for chronic pain. And I don't think it draws the clients who really want to work with me to create the body they need. Pain-free mobility. A little bit better if I could get them to communicate with me. So yeah. I'm gonna get a good grip here. I'm gonna pull this back and open. And again, as I'm pressing right into levator scapula, the upper trap, when I'm pushing her shoulder back, it's still lengthening, just a little, not as deep as before, but it's still getting into pec minor, pec major, rolling that stuff open. When we roll that stuff open, it's a little bit more like that thoracic extension, rolling the shoulder blade back. How many people are stuck forward all the time? Most people, including me. When she works on me, she does this, and I'm, oh, that feels, because everything just pulls us forward. That's a normal portion of us walking upright and dealing with our world where it curls us down and forward. So as I release pressure, I'm going to press into her shoulder and just release that knee very slowly. I'm going to give her just a second to kind of recalibrate. And she naturally just kind of stretches. The clients do this all the time. Is it itchy? A little bit? It's probably just from like texture of like my clothing and pressing in. Yeah. And then from here, if I want to come in and make a second pass, I can take off that left shoe. I can anchor right at the sacrum, pull her back and open. And again, pull her back and open. Got a forearm here, so I can do a little forearm or hand work. Now, what's primary? The twist is primary. This is the secondary and tertiary component. You're going to see that again and again in the trainings. I want to highlight that, okay? Because once you learn how to do the first part, you can add pieces because your hands are free, because we're using our legs and feet, multiple points of contact. You juggle. You learn how to do this. How's that? Cool. How's this in your tricep? Okay. How's this in your bicep? Cool. How's that in your deltoid? Cool. How's that in your rotator cuff? There's tons of options, right? If I'm willing to work at it, and I'm going to work down right along the spine again, right? Right up through here. Feels real open through the lumbar. Fluid, free, no restrictions to movement. When I get to the thoracic, I feel just a little bit of tightness. I'm going to pull her back and open. You can see this grip above the wrist. If I just pull here, there's potential that we could get some separation at the wrist. A little bit can feel good, but you wouldn't want to yank particularly, right? You don't want to separate that. So what I do is I grab over the wrist. If I want a second grip, because it's too much skin pull here, I'm going to reach that second hand here, pull them back and open. I can put my foot right around the shoulder blade. In her case, I can just lift her off the table. I can literally roll her shoulder blade over my toes, lift her up. Bring her up. Going to bring her back and down. And then we already did one pass, that big compression right at the top here. But if we get into the neck, she naturally just kind of moved her head, I think, into a position where she feels comfortable. Do you feel okay if I come and deliver some pressure back here from that position? So sometimes also, if I had a pillow or a bolster, you get that marshmallow pillow where it's super just smoosh. It's almost like it would almost like press onto her socket, her orbit around her eye, or maybe like block her breathing a little bit. So you're gonna have to be mindful of what kind of pillow you have or what kind of cushions and bolsters. I really love having these yoga blankets because they're props that I can customize to the session. Now, just like I showed before, I want to be able to do this from the standing position first, and then I'm going to show you the easier version that I actually use, okay? So if I come in and grab like the shoulder here, like I can pull this down, I got to lean over, right? And I can come into the posterior right in here. Now, in her case, because of my arm length and dimensions, it didn't work as well for me to grab. So what I'm going to do is I'm almost going to grab with the soft part of my forearm along the deltoid. So that's going to give me some control. Then I can sink in here. There. So a little more up or down. She's like, the whole thing.
All of it. Pretty much. I'm like, all of it.
She's like, it never ends.
Yep.
And the clients will do the same thing. I think that the sense of humor is something good to bring to practice, especially when we're dealing with pain. I'm going to hook in the posterior and give her some up. There we go. Now, more to the front, more to the back. And tell me when. There we go. Is this too much over here? Now, what I'm doing in the neck, primary. This hand is secondary. Primary. Now, what I start to feel is I feel some strain in my deltoids. And the reason I feel strain is I'm using all the muscles around my shoulder joint to stabilize my humerus as I deliver pressure with my ulna and forearm. This feels like more body strain, whereas the pressure I was delivering with my knee into levator scapula felt more stable and secure. I'm using much bigger structures with my knee, which is an elbow on steroids. So this version here, I'm gonna back out. And that's totally fine, by the way. You can continue doing that one if that feels good to you. Like if you have table height and like you want to sit in a chair, like tons of options. Feel free to adapt what I'm teaching you to your body. That's one of the more challenging things is if you're not as tall as me and your client is much larger or more petite than you are, can change some of the body mechanics. But I'm always going to show you the version that I think is most accessible, and then also is just going to ease your strain as much as possible. And she loves that compression to the posterior cervical spine. I can tell. She's just like, oh, please. So I'm going to come in and sit, and then I'm going to stack, just like I talked about. I can have a receptive hand. In this case, the way I'm going to fit is like I'm having my leg on my hand, and I'm going to hook right in. And how's that? Okay. Now, more up or more down? Okay, tell me when. She even changed her head position just a little bit. Change where my hand grip is. What do you think? More to the front, more to the back. Okay, right there and up. There we go. So I described that verbally, okay, because we were going to the back, to the front. Then I was going up towards the head, down towards the feet. I do this all the time because I'm accessing her nervous system using skin stretch. I'm trying to get her nervous system to unwind because it's like we hooked right, and he hooked in right into that spot. There we go. Now a little more to the front, a little bit more to the back. Right there, all right. Right through. Now if I shear, give me a shear just a little further up again. There we go. And as I go into these muscles, again, back muscles are really complicated, but I think we're hitting semispinalis, capitis, and the suboccipitals. In addition, because of where their insertions are, we're also getting into, right up in there. See how the trapezius goes up? See how the levator scapula goes up? We're still hitting some of that. When we're talking about muscles in the back, this is inordinately complex. There's just layer after layer. I'm giving you a basic tool, but you can use these tools almost anywhere. So long as you think about anatomy, think about what you're doing. If you need some, private consulting with me, just hire me for that. But I'm going to continue teaching you layer after layer so we can continue working on this. I'm going to come back there. Now, a little more to the front, a little bit more to the back. Okay, tell me when. There we go. And then up. There we go. The other thing is the clients who want the relaxing massage. Those aren't my ideal clients. The clients who are like, dude, he gets right into the spot. Those are my clients. What she's doing is creating a situation where I can maximize the session and its effectiveness for her when it comes to pain relief and mobility. That interactive client was a little bit better for me and a little bit better for the business that I was trying to build. It made it easier to help them with chronic pain, get greater Google reviews, and then draw more people who had physical issues that were soft tissue related that we could work on. So I'm gonna, just for a second, I'm gonna disengage. I wanna go a little bit higher right into the base of the skull. Just a ½ inch maybe a quarter inch higher. Now if I'm right there. More up. There we go. And then what do you think? More to the back? More to the both, okay. Do you want me to hang out in one spot? Or is the back and forth good? She helped me choose what it was that she wanted. She liked it, the back and forth, kind of going back and forth along the base of her suboccipitals. I'm going in and pressing on that. I'm right at the base. I'm right at the base of the skull, kind of where the green and blue is. I'm more right in there, able to deal with that muscle in a way that works. Now, do you want a little more point or a little more broad? Okay. Right in. And she directed me. She gave me permission to go just a little bit deeper. We're working her edge. And I think that's where the sweet spot with the nervous system comes in. We're delivering a stimulus slowly, incrementally, and allowing her nervous system to respond to that. I feel just a little bit of tension in my deltoid just because I'm using the muscles to like stabilize the head of my humerus, but I'm not going to be here much longer. I feel generally my work keeps me very mobile and in fairly decent shape, though not from a cardiovascular. I'm going to slowly back off, slowly kind of move my leg positioning so I can lean back. Because that can be really, really intense. You definitely want to release that just a little bit more slowly. She's moving around and she just sat up. Yeah. So what do your clients report? Do people get sore because we do this? Yeah, usually not less sore.
Yeah.
People are always telling me they're really amazed. They're like, man, I don't know how you go so deep. That's what they'll say. I don't know how you go so deep and not bruise me.
Yeah.
But I think it's because I'm using an elbow on steroids. It's a bigger, broader tool, which means I can take some pressure, but it's not sharp and pointy. It doesn't make them recoil like an elbow. It puts them in a situation where they can receive that input into the nervous system. And sometimes you have to change it. Sometimes the knee I show, it's not the right tool. It's just not. It doesn't fit that particular client. What I'm going to do over time is give you more tools to be able to access any given situation you deal with clients. This class specifically is on upper back and neck work. This is the 80th percentile. This is going to work for 80% of those upper back and neck clients that you see. The ones that they don't have a herniation, they don't have a real medical issue, they didn't have a cervical fusion, those people can still receive this, but they're probably not going to have as much of a profound response. It's the people with that average just upper back and neck tension because they work at a desk. They type too much. They drive too much. Those people just freak out about what I'm doing. On camera, I don't think it looks very impressive. It looks kind of boring, actually. But it's profoundly good work for upper back and neck pain. So she did all the work for me. She knows the drill. She's already moved herself around, propped herself. Clients will do this, okay? Clients will do this with me so much. Are you ready? The regular clients I see, they'll be like, hey, listen, can you come put your elbow on my neck? And they'll basically grab my arm and they're like, can you get me right there? They'll put me in position to work on them because I'm the massage tool at that point. that's a good thing. And I feel like what it does is it creates that client who's like working with me on their stuff. They're not questioning my judgment. It's just that we've worked on things. They know how I communicate and interact with them in session. And it brings more nuance as I continue to practice. Now that I've got her on the opposite side, I'm going to come in, and again, what am I lengthening? Mainly the pec and pec minor, but they're getting some rotation to their back, to the muscles along their spine, including the rotatories. What I'm going to wind up doing is isolating at the lumbar spine so I can go ahead and give her a bit of a twist. She naturally just sat up, like we maybe even skipped like a single move or something because she was just like, oh, okay, I guess he's done. But what I'm going to do here, oh no, it's fine. Anything. If I have to go back, I'll go back. I don't care. So what I'm going to do in this case is my right foot, I'm going to slide off my right shoe. I'm going to put that foot along the sacrum. Then I'm going to have her arm and roll her back and open. So what happens if you got 5 moves and you use the 5 moves on one side and on the other side you only use 4? They explode. Horrible, horrible freak science experiment. No. Just different. Generally, a little bit of balance. They have more problems on the right side. That might be the side I work first, but it doesn't mean I wouldn't also work the left. They need something to compare it to. As I'm going through here, is this killing you? Like, feels good. Right along the sacrum, pulling her back and open. Above the wrist, a little bit of the forearm. You can see that right here. You can even knead through that a little bit. That open. And then from here, I'm going to bring her down to neutral. I'm going to slide my shoe on. And then I'm going to come sit my hip right next to her sacrum. Okay, I'm going to bring my leg up. I'm going to scoot down just a little bit. Can you scoot up just a little bit that way? A little bit. You can scoot the pillow a little bit higher. There we go. And then I'm going to reposition. I want to be able to grab right here. Now, where I'm seated is almost right at her sacrum. She can feel my leg on this side. She knows she's not going to fall off the table because I'm blocking. Pull, lean her back and open. Pull down a little bit right here. Back and open. Going to work right along the paraspinals right here. Allows me to put some finger pressure and just rock. This is where the movement comes from. See how this hand is just static? This guy here is just hanging out. Like I'm thumb wrestling. There. In. There. I want to go cross fiber. Ooh, 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 ooh. Let me know. She felt it. Two, there, right, and 2, there. Now, I'll also point out, on the second class next week, we're doing a lot of the same stuff, but on the mat. And I'm going to show you very rapidly why you want to work on a mat and why you're going to add it to your practice if you haven't already. You're going to see how easy this stuff is on a mat, and you're going to go, whoa, this is super easy. And it makes your practice stand out. Close-on work creates potential for you to make video and promote your practice online in a very robust way. I'm going to pull her back and open. Now, I can give her the choice. I can pull her straight down towards the tailbone or back. Okay? And it might take a little more nuance this time because this is the second time I've worked on her. If I roll you back like that, do you want to go back and down? And it doesn't matter to me. I'm just giving her what she likes. I'm rolling her just back. coming onto my leg, a little bit onto my kneecap. Right in there. There we go. There we go. Lean up, pull you along there. Now, do you see, and this is the thing is, she's received this will be the second time on this side, but it's more nuance. We superficial to deep, general to specific. She's asking for a little bit more depth, a little bit more focus. It's like rolling her back. In there. Her back. In there. Now, the treat for myself is if I do this all the time. Like I get in work mode, right? I don't want to work. I want to hang out. Listen to NWA. That's right. So I'm going to hook right here. I'm going to lean back, but I'm going to open my shoulders, allow my head to go. What are we doing? There we go. So we got to trick the client into being a counterweight so we can stretch. Don't tell them. Don't tell them. Don't tell them it feels great for you. There. Now I can come back in, right into there again if I want to go for another pass. A little bit of cross fiber friction. This is a great handle to be able to mobilize the scapula, mobilize the shoulder blade to be able to pull the chest open. And again, when we're doing that, what are we primarily, working on? Pec and pec minor. We're rolling that guy open, okay? When we wind up pulling the shoulder down, it's hitting those neck muscles, lengthening some of that stuff. When we lean down, trapezius and levator scapula, it's affecting, bigger, broader structures. Generally, what we think of as just the back. But what we're really doing is we're doing a one-sided back bend. We're really allowing what's happening over that ball right there. Is we're back bending on one side to get them out of thoracic flexion and into thoracic extension. Pull her back and open again. And so the back feels better now. There we go. I'm really using my leg as a prop, like I'm rolling her onto my leg. To even give it more nuance, what I'm going to do is I'm going to roll her slightly forward. I'm going to move my leg a little bit closer, and I'm going to turn my leg just a little bit. And this is about how it's going to hit my knee. I want to be able to grab her again and see if I can roll her over my leg. And I got more lift that time. I was able to really roll her. You can see her coming off the table there because she's rolling up and onto my leg. How does that feel? There you go. So I'm going to bring her arm up. I'm going to come into some pressure up here. How's this? Yeah. Are you dying? Yeah. So you guys did this last time, so we're just going to go right on in. You've seen this. I'm going to give a little bit of space right in here so I can bring that shoulder down. Then I'm going to see if I can lean in. I'm kind of at the corner of the table here, right at the back, just kind of taking note of my position. And then I'm going to bring this knee up and over. Hey, how's that? There we go. So a little bit to the back with the shoulder. So if I grab here, you like that? There we go. Now stack body weight in a way that feels comfortable. You're going to gain more strength and control over your core muscles, your legs and hips over time as you work with me. You're going to be as nimble with your feet and knees as you are with your hands, forearms, and elbows. Trust me. If I grab with this left hand, I can grab with the right along the forearm here. And that way I've got that primary, secondary, and tertiary contact. And like I'm doing 3 things at once. Right in there. Now, I don't know if you could see this, but I kind of had my hip shifted over to the right, and then I shifted it to the left, and it changed the angle that my elbow on steroids was pressing into the top of levator scapula. Right there. And more pressure. Okay. She wants a little bit more, so I'm going to think about how I'm going to change my angle just to give her a bit more. I'm going to bring this leg in so I'm a little bit closer in so I can lean a little down because I want more leverage. Go from there. There you go. Is that too much? On the edge, but better.
Yeah.
Where you want it. There we go. Wow. Just felt this whole superficial layer of trap, just like all of a sudden, just woo. It was like a ripple from her spine out to her shoulder. Just go. More to the back. There we go. Oh, Lordy Jesus, Jesus. I love when the sessions turn into the gospel hour. There are many calls out to Jesus, whatever Savior. Good God.
Yes.
Right in there. Now, if you don't feel comfortable doing this, can you do it with your forearm and elbow? Sure, absolutely. You guys know that. That's where I'm going to give you more options. I'm trying to expand your tool set. This is the one where we use our knee today. I just want to show you that because I want to give you more options on a table. I want to expand your table practice. And once I really expand your table practice, guess what? Say, I need a mat. You go, Sky table ain't big enough. Sky mat. Sky mat isn't big enough. Sky mat doesn't allow leverage. Sky mat doesn't allow you to use your legs and feet enough. Now, I'm getting a little bit of tension just in my right side and my low back because of the way I'm stabilizing. I'm going to put some pressure here and back off slow because that was a big, deep compression. I'm going to give her just a second because there was a lot of pressure there. I'm moving around, just kind of shaking out that hip. You know, if I wanted to take off my right shoe and give her a twist again, I could. Just giving her a second to kind of get her composure. How you doing there? Still good? Oh. Oh, okay. Yeah. So I'm going to come back and in just like to where we started again. Okay. Or not started, but second thing we did. I'm sitting right at the sacrum. I'm going to give her some pull here because I gave a little compression to that top portion. And I'm not going to do the standing version because I don't really like that. I don't use that one as much on a table. I really like the one that I'm seated. I feel like it's more comfortable. It's easy for me to deliver. In there. Dying. Almost. Almost dead. Higher. So what I found working in a chiropractor's office, when I developed this in my practice there, the clients didn't come in and say, this isn't massage. The client said, man, this is amazing. Like, why aren't other therapists doing this? And that started my real teaching practice. Because it was weird to have something that they didn't really recognize as massage itself, which became table, cream, glide, and nudity. And I took away the cream, the glide, and the nudity just on a table. And that was a transition to get them to the mat. And once it got to the mat, they never came back. They never wanted to. They're like, dude, this is roto-rooter, man. This is what I came in for. I didn't even know this existed. Now, I'm going to bring her arm back to neutral there. I'm going to see if I can find an angle. So her head is about neutral here up. I'm going to bring her forward just a little bit. Is that still comfortable? I'm just trying to create a little bit more space so I can get into the posterior cervical spine right in here. And primarily what we're getting into is, again, semispinalis capitis, the suboccipitals, but we're also hitting our old friends, levator scapula and the trapezius. Lots of layers of muscle. If I don't cover a specific muscle, it's because if I covered all the specific muscles, we'd be here for hours on end, just going over anatomical minutia, instead of just giving you tools that you can use on all of those posterior muscles in the posterior chain. So from here, I'm going to come in and I'm going to have my receptive hand probably on my thigh. We're going to see how this works. Do it a little higher. I'm trying to find a spot. Like, it's like I'm grabbing and pulling the shoulder away and then leaning down, kind of kneading through here, trying to find the spot. I think right there. There we go. And then from there, is that up? There we go. Is that too far? You want more to the front? Or to the, tell me. Now, this is where I get to hang out. They have no idea what's going on this side for me. Like, they're facing the opposite direction. It's like, do you want a little more pressure? Okay, so I'm gonna lift my arm. I'm gonna create some space on my shoulder because I open my chest. There. Oh, right there. Because I can stretch while I work her. Now for a second, just so I can show it from another camera angle. Because when I stack up like this, there's a little more body weight leaning down right there. Rotate my arm. Like this. Or up. Or to the. Say, uh-huh. Dying in there. Right in there. Too much? A state of oh shit has been declared. Right in there. And this is stacked. If you're doing it well, it's comfortable. It's easy. Amazingly effective. If I took this little clip and put this on YouTube, mostly ignore it. It wasn't an exciting stretch. But for people in pain, ooh, amazingly effective work. But it doesn't always appear extremely visually flashy. Feel the muscle tension just like hanging out. Feels like I'm at the top, more towards the suboccipitals, more towards that big meaty junction of semispinalis capitis, maybe splenius capitis, a little bit of all of that, leaning right down and in, right into there. Hard being gangster. You think it's easy? Who taught Easy how to record an album? I mean, other than working with Drake. Gnarly, but I got pretty deep, like elbow right there, right to the edge, right to the edge of my elbow, right down in there. But it doesn't feel like too much, does it? It doesn't feel painful. It feels like it needs to happen. Yeah. Yeah. And all I do is hang out. This isn't a thing about force. I talk about compression, but it's not pounds per square inch. Skin stretch. It feels deep. I mean, when you work on me, it feels like you're going down to my spinal cord. Whew, that deep. But it's not excessive pressure. It's not pounds per square inch. Now I'm going to change my angle just a little bit. You'll see. Watch the shoulder. It's going to drop. A little bit more there. Too much? Okay. More to the front. More to the back. It's awful. Great. That's why they leave me all the tips, because the work is awful. So not too much pressure. Not painful. Okay. You don't need me to back off, but it's intense. There you go. Do you have any referred pain? Where? Right into the front. And I want you to hold that for a second. Feel it right in the front. Is it like not in your eye, but it's in the forehead? Okay. I don't want you to be afraid when clients report things like that. She pointed right to her forehead. I don't want you to be afraid, okay? She feels referred pain. Now, if the referred pain was too much, I could back off. If the pressure where I'm pressing is too much, I can back off, either or. The sensation will probably die down once I release that pressure. People will feel referred pain all over their body. And when you start to look at those referred pain patterns, that's what makes you a mechanic. It makes you have the capacity to be able to ask people questions and know what muscle to go to, because you know that the infraspinatus refers pain in a certain way. And in her case, probably splenius capitis, kind of what I'm leaning toward. See a lot of that. Here. Now if I lean just a little bit more, 8. Holy moly moly was declared, state of holy moly moly. Right there. Did too much. On the verge, but not excessive. Low and slow. Like Texas barbecue. Can you speed it up how you cook the brisket? Not traditionally. Low temperature, long duration. That's a tendency within my practice. I move towards 3-hour sessions on a mat. They're like, why 3 hours? And I'm like, well, do people relax more after an hour or 3? I'm like, well, 3. And I do more pain relief stuff in 3 hours or 1? Well, 3. And I'm like, sell 3 hours. That was what I chose to do. Doesn't mean you have to do that, but it is an option in your practice if you decide you want to. So as I come in, I'm going to give it a little more nuance. I'm leaning a little bit more into my elbow. You can't quite see it. I'm using my other arm, but I'm leaning. What do you think? Right there? Is that too much? Okay, I'm going to back off just a little bit. Better? There we go. It's not about me delivering excess pressure. Uncomfortable. Do you need me to change it or back off? Better? There we go. And that's good. Also, if I was working with a client for the first time and we were getting to know each other, and they finally said, hey, can you back off a little bit? I'd say, hey, thank you so much for letting me know. I really appreciate it, because it just allows me to rest more. I don't have to work to like push in. And then I would remind them, I don't want to cause you pain. I don't want to use excess pressure that's uncomfortable, but I want to get to that sweet spot, that hurts so good feel. That encourages that communication back and forth to let them know that I want them to communicate with me. I've seen this with many massage clients. They're utterly just taken aback with how I communicate with them, because they're used to just being the passive recipient of a service. Okay, More to the front. Is that too much? Not at all. Too much. Now, when we get into here, again, really suboccipitals, the green and the blue guy particularly, really getting up in there. You're still hitting semispinalis capitis, splenius capitis, trapezius, levator scapula. We've gone over that. But it's accessing some of that stuff that's in the posterior. Really, really good work. Amazingly effective. If you add this into your table routines, trust me, you're going to have access to this video. You can watch it again and again if you need to review. Grab some therapist friends. Work with them. If you're not working with us live in groups, CE party, bro. What are you doing? CE party. Get a charcuterie board, serve some wine, do whatever you're going to do. Come on, CE party. You can watch this with your colleagues and work on each other to learn from this. When you receive this, and that's part of the key part of like working with me live this way, you're going to understand the work internally, having given it and receiving it, and understand things about angle, leverage, pressure. How you doing? It's okay. So I'm going to give her a break just for a second. We've been there for a while. I'm going to back off for a second. And I'm going real slow, just letting her like decompress. So was it too much? Getting to the edge where it's like you couldn't take anymore, right? But it doesn't feel like I beat you up.
No.
It doesn't feel like I stepped over your boundaries. No. It's just that he's like, man, yeah. But you can also see probably on camera here, if you look at, you know, skin color, we're both very pale, but you see how there's a little therapeutic inflammation through here? There's just a little bit more blood flow, at least at a skin level, because of what we were just doing. I'm going to, again, go ahead and back off. I'm going to come back and up because we were doing a compression. The compressions are deeper, sometimes a little more intense. I'm going to come down, and just like we started, I'm going to slide off my right shoe. I'm going to block her at the sacrum, and I'm going to roll her back and open. Roll her forearm here. I'm hooking this thumb down into her forearm extensors. I'm going to explore right along her spine, and again through her lumbar, and so this just feels like butter. It feels soft, mobile. Once I get to the thoracic spine is where she starts to have a little bit more tension. I roll my toes around the shoulder blade there. I can even give some traction, a little pull to the hand here, around the fingers. Work through there. Pull this guy back and open. Maybe around the shoulder blade, pull her back and open. Not pulling skin by up here too much. There. Bring her back and down. Slide my shoe back on. And then I'm going to go ahead and have her go ahead and sit up. I want to see how she feels. You know, we did both sides. So what's the difference between when we started to now? And you received twice. Greater range of motion.
Yeah, this is a lot more.
Yeah. So this is what my end of session would look like. Andrea, listen, I really, really enjoyed working with you today. Like if you were a first-time client to me at the chiropractor's office, like replicating what we just did, you know, I'd say, listen, I think you're just having tension in your upper back and neck from, you know, whatever you're doing, working out, or all the stuff that we get from like typing and everything, driving, you know, I have that as well. If I could see you, I think in your case, like once a week, once every 2 weeks, you know, I think it'd be a great way for you to just do regular maintenance on your body because of your active like workout regimen. You know, if you're interested in booking that, you know, please just talk to the front desk and they can go ahead and schedule that. What I'm doing is, one, I'm making eye contact and letting the client know that I want to work with them again. So, yeah, it's like you're really an ideal client for me. I enjoy working with you. Thank you so much for like the feedback to like find like where your, you know, sweet spots were. I'd love to work with you on a regular, ongoing basis as you're like on your wellness and as your therapist or whatever. Then what I'm doing is I'm creating that situation for the potential for the rebook. She's much more likely in a state where she's in now to like trust me and then consider me a professional. And I'd say, listen, and I had this at a point at the chiropractor's office, I had to build it because it started on a table. They didn't want mat, they didn't know what it was. They eventually had an extra room with a mat. And I helped so many people on the table, the boss just went, whatever you want to do. And I'm like, oh my God, they wouldn't even let me do that when I started. But it was because I demonstrated its effectiveness. I'd say, listen, next time you come in, make sure to wear something like this, like that you came in. I would like to do the same thing to you, but on a mat. It's going to give me even more options. And they go, okay, whatever you want to do. And that is how you create a mat practice. It is not by avoiding the table. It's not by getting rid of the table. It's by taking the clients you have and transitioning them, expanding their parameters for what massage and body work is to the point that it opens up that space for a mat practice.